So let's have a look. These portal systemic anastomoses. Here on the screen, we can see the normal portal system in this purple colour and the systemic circulation in this blue. And we can see that if blood can't pass through in this direction, typically it go into the portal vein and then into the liver in this direction. If this is blocked, if this is prevented, then blood can actually pass up via these esophageal veins into your esophagus system, and that will take it back to the heart that way. Now, what we can see if we look into the internal aspect of the esophagus, we see a normal, nice, flat architecture to the inside wall of the stomach. But if we look with these esophageal varices, where these usually quiescent blood vessels are now swollen, we can see that they're actually causing these bulges into the wall of the esophagus. These can potentially rupture and leak blood into the esophagus, and you may cough up, vomit blood. So that's one of them, the esophageal and gastric anastomoses. The connections between these gastric and esophageal veins connect to the esophagus system in the thorax. And like I said, if these were to rupture, you can get some quite severe bleeding. If we now look at a second portal systemic anastomosis, we can see these are occurring at the rectum by these rectal veins. We can see that typically the superior rectal vein is draining blood up in this direction, but we can also see that if blood is prevented from passing through the liver, then it can actually drain into the internal iliac vein via some other rectal veins, via your inferior or middle rectal veins perhaps, and these can pass back into the internal iliac vein. These can pass back in this direction. Now, because again, these blood vessels aren't used to receiving this proportion of blood, then we can have what are known as hemorrhoids. We can have bulging of these blood vessels into the wall of the anal and the rectal canal. And we can see some internal ones here, and we can see some external hemorrhoids here. So that's the second portal systemic anastomosis.